Mr. Thompson, you're recognized.
Thank you, Mr. Chairman. Thank you for calling today's hearing, and I want to thank the witnesses for being here today. Although I think it's ironic that we're holding a hearing today on long-term care facilities while the House Republicans are in the process of cutting $880 billion from Medicaid. 63% of all long-term care patients rely on Medicaid coverage to pay for their care. These cuts to Medicaid will hurt 26 long-term care facilities in my district, which provides services for 8,000 patients, half of whom rely on Medicaid. And it's not just patients who will suffer from these cuts. Long-term care facilities support 8,500 jobs, pay $548 million in salary, and contribute $183 million in federal and state taxes. As soon as the Republican budget was announced, I met with healthcare professionals in each of the 5 counties that I represent. What they told me should concern everyone on this dais and every American. They said that the Medicaid cuts in the Republican budget would hurt people on Medicaid and also veterans, people on Medicare, and people with private insurance. These drastic Medicaid cuts will mean 54,000 fewer people will be covered by Medicaid or CHIP, also known as the Children's Health Initiative Program in California. Rural hospital closures will lead to longer drive times and more preventable deaths in emergency cases. The large hospitals that are able to stay open will cut specialists, leading to fewer local treatment options for Medicaid recipients as well as people with private insurance. I also heard that larger systems will pull back on support for long-term assistance and programs to help keep people in their homes. Without Medicaid-funded equipment, some people with disabilities will be unable to get out of bed and go to work. Some will not be able to stay in their homes, which will mean a higher cost to taxpayers. These Republican Medicaid cuts would cause a $2 billion reduction in economic activity in my district alone. That hurts Main Street. Mr. Chairman, I know that members on this dais will object and say that Medicaid and Medicare and Social Security aren't mentioned once in the Republican budget, but as you know, you can't cut $880 billion without touching those programs. And along those lines, I'd like unanimous consent to enter into the record this news article where Mr. Musk is talking about going after and cutting Social Security. And these are all life-saving programs, and they're being dismantled. The health and the economic impacts are going to be felt in every congressional district and by every American. Can I get you?
Yeah, without objection.
Thank you. Mr. Carlson, please expand on how Medicaid cuts in the Republican budget would impact people who are on Medicare, private coverage, or are veterans who use the private health care system.
Thank you. The important thing to note is that Medicare is not comprehensive. I'd like to focus on that it doesn't cover long-term services and supports on a long-term basis. There's some nursing facility coverage, but as mentioned, only after a hospitalization of at least 3 nights and only for a particularly intensive level of nursing care. So Medicare doesn't cover these long-term services and supports that people need, either in a nursing facility or particularly, as you note, for at-home care. It's worth noting that at-home care is particularly at risk from the cuts that are proposed. These home and community-based services are not mandatory under Medicaid. They're optional programs, and they're particularly vulnerable to cuts like this. If the cuts of the magnitude that are being proposed were to come into effect, states would have to look at their Medicaid programs and make drastic cuts, and it's very likely that those would fall heavily on the home and community-based services programs that are optional, and these are the programs that provide care at home. They provide home modifications, they provide personal care assistance, they provide home-delivered meals, they provide daycare, so all of that care in particular would be at extreme risk if cuts like this were to go into effect.
Thank you very much. And I just can't tell you in strong enough terms how concerned, upset, and unnerved constituents are across the country about this proposal. Thank you. I yield back.